Senator Cassidy.
Thank you. I'll try and restore a little calm here. And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that. I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed. If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars, we reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. Now, let me ask.
I'm happy to explain why.
I had 3 minutes and 30 seconds left.
All right.
It also surprises me because you've canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems, just to cancel, it seems like an incredible waste of money. But it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this a speech that you don't want me to answer? Because I want to answer that question.
Please.
If it's a question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed, because there was low natural immunity and there were people getting very badly injured by COVID. But it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatments. And there were no mandates. And then
okay, I have another question, so please, about 15
that's when I began litigating against President Biden's mandates. Now,
I'm sorry, let me go on because
in terms
you've
of
covered
me
the mandates
canceling
before.
those contracts.
I have limited time, Mr. Secretary, I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board,
Senator, excuse me,
can I have my time back?
Yes.
Yeah. What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay. But it's not a financial. It's not a financial conflict. It's not a financial conflict of interest.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia, occasionally gives me help. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her a vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Senator Barrasso.
Thanks, Mr. Chairman. Mr. Secretary, thanks for being with us today. I believe one of President Trump's greatest achievements was his bold and successful actions on COVID. When faced with a global pandemic, he didn't back down. He was determined to find a cure, and through Operation Warp Speed, a vaccine was developed that distributed quickly, safely, effectively, and I believe it saved many, many lives. I think it's a model of American ingenuity and public-private partnership. But this wasn't the first time an American president acted boldly to address disease and vaccines. There's a great book that's out. It's a prize-winning book called The Fate of the Day by Rick Atkinson, and he talks about the courageous efforts by George Washington. During the Revolutionary War, George Washington reversed his opposition to the smallpox vaccine, and he ordered that all the soldiers be vaccinated. It was among the most consequential decisions Washington would ever make. By protecting his troops from smallpox, Washington preserved the Continental Army, which allowed our nation to continue to fight for our independence. And like President Trump, I believe President Washington acted decisively to protect Americans' lives at a time of great national peril. So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. Recent polls said 89% of voters, 81% of Trump voters agree vaccine recommendations should come from trained physicians, scientists, public health experts. So, they believe, Senator Marshall, Senator Cassidy, they believe me when it comes to vaccines. If we're going to make America healthy again, we can't allow public health to be undermined. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
We're going to make it clear, evidence-based, and trustworthy for the first time in history. Right now, when I was a kid, I got 3 vaccines. I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant, between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines has ever been tested against an inert placebo. And what we're doing now is any new vaccine that before it's approved and licensed will have to demonstrate safety against an inert placebo. And we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
I mean, Senator, I would point this out. Right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true, that we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it, and we're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy.
Thank you. Finally, with chronic diseases like you, I'm committed to addressing our nation's growing rate of chronic diseases. I think if we're going to make America healthy again, we need to support rural primary care providers that play a role. As a rural physician, I want to make sure we can prevent and manage chronic diseases in their communities, and I ask for you to continue to work with us specifically with regard to rural health.
Thank you, Congressman.
Senator Tillis.
Thank you, Mr. Chair. Secretary Kennedy, thank you for being here. A couple of times you asked people if they were making a statement or a question. What I think I may do, just to give you a breather, is to make a statement with a lot of questions. And just for the record, I'd like for you to have the opportunity to have your staff respond. I can't conclude from the discussion today where you are on warp speed. So I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were there things that worked? Were there things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump, and the mRNA platform is something.
I agree with that.
I look forward to you giving us a detailed statement on exactly where you are with warp speed. I'm not a doctor. I'm not a trial lawyer. I'm a boring management consultant. Another question that we'll submit in the record, I'll give you directionally where we're going. I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later fire her because, at least the public reports say, because she refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the person, just for the future nominee that we're going to have to consider. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that, and I'm sure that you will have some. You will do nothing that makes it difficult or discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the $500 million for further mRNA research, and just want an answer for it. On H.R. 1, I believe you know my concerns about H.R. 1. I've had several meetings with, and H.R. 1 is the big, beautiful bill, OB3, whatever the brand is. But I'm still, I've got an office with 60 staff, including half of them in state office. I've had 3 different estimates of the economic impact on the state of North Carolina. Can I get your commitment? And I have been looking for somebody that's far more resourced than an office of 30 people up in here in D.C. to disprove my estimates with respect to the impact on North Carolina, period. And I've yet to have anybody. I would love to be embarrassed and be wrong, but I would like to get your commitment for people to tease through the numbers that I provided before the vote on H.R. 1 that says that if you normalize 3 independent estimates across a broad spectrum, $25 billion over 10 years. I don't need your response now. I want somebody to destroy my estimates because to this point, the most resourced health agency in the world has only given me word salad responses, and I need that so that we can prepare for the response. $25 billion over 10 years is half of the Rural Relief Fund over 5 years. And so we just need to have that fact as a matter of policy so that we can go in North Carolina and absorb it. And I know every state's different, and I'm assuming every one of my colleagues here have done the math for their states, not focused on that. But I want you to destroy my estimates if they're in fact wrong, and I want you to acknowledge them if in fact they're right. That will come into question as well. Mr. Kennedy, you've stated multiple times in response to other members' questions that scientists were lying. We'll go back to the record in cases where you've said that. I'd just like to see the scientific evidence to substantiate that. I'm going to stipulate that you were honest and you had research behind it. We'll go back and figure out what scientific studies you believe are founded on lies and not scientifically viable. And then finally, I just want to give you an opportunity. Apparently in the exchange with Senator Bennett, you said you agreed with Dr. Levy's statements, who said that the mRNA vaccine caused serious harm, including death, particularly in young people. They said you agreed with that comment. Did you agree with that comment or not?
I think that's true, yes.
Okay, thank you. Thank you, Mr. Chair.